Hey folks, Chad Duplantis here with Dentist in the Know, and I am here with what I consider one of the most innovative companies in dentistry, Ivoclar. I've got Dr. George Tysowsky and Don Bell with Ivoclar, so I'm going to let you guys take it away and just give some brief introductions and tell us who you are, and then we're going to get right into it.
Sure. Well, Chad, a pleasure to be here. Thanks for the invitation. I'm George Tysowsky. I'm Senior Vice President of Technology and Global Director of Professional Services. So I'm responsible for all the technical activities in North America and then globally all the professional relations. And I've been with the company 40 years. It's been a great ride, and I'm just getting started. So
That's cool.
Good.
That is 40 years.
Yes.
You don't look 40, man.
Well, I start early.
All right. All right.
Don Bell, Vice President of Product Marketing here in North America. So I manage the product portfolio for clinical products and technical for North America. And then I have a dual role as well globally where I align with the global headquarters on marketing activities, messaging, tools, etc. to make sure we're in alignment with overall strategy and messaging globally that we execute here in North America. So we try to keep all of our regions consistent with how do we go to market around the globe from central location.
Awesome. Well, thank you all for being here. And I want to start off, in the introduction, you heard me say that Ivoclar is one of the most innovative companies in dentistry. And I truly believe that. Whenever we come to a show, you guys are always front and center. And we all know that your product is one of the highest levels out there. So tell us a little bit about this year of innovation.
Sure.
That's going on right now.
Well, as you know, the foundation is technology driven for Ivoclar. That's our foundation of science, innovation, and new products, and testing and substantiation and reliability is real critical. And so we're celebrating the year of innovation this year, as we do many years, but specifically this year with some real key new developments. I'll cover the technical side. Obviously, your readers or viewers know e.max, which is a foundation of our products line in lithium disilicate on the technical side. And we've celebrated last year 20-year anniversary on e.max with all the millions and millions of restorations have been provided worldwide. Taking off on that, we've expanded into the Zirconia field, and we have our Zircad Prime, e.max Zircad Prime and Prime Aesthetic as foundations with the highest aesthetics with the GT technology, which is a gradiated translucency level. And at this meeting specifically, we're also introducing a characterization material called IPS e.max Ceramart, which is a specific characterization material with structural paste and special glazes, et cetera, that really simplify and enhance the aesthetic outcome. So we're really excited on the technical part, and I know we have more innovations to come.
Yeah, and so we'll expand on that a little bit for the workflow. We're launching new mills.
Okay.
I'd say lab specific, they're larger mills, but they can also be used in dental practices. And they've been upgraded significantly. So they're faster, they're more durable, more robust. We've speeded up a lot of the CAM technologies in terms of what materials you can mill. And we've also added some partnerships along with that. So we're adding Des Abutments as a validated workflow partner to mill specific implant abutments to service all the big implant companies, and then us to restore on top of it. So it's from George's point from the Zirconia to the Ceramart to the mill, you've got a really nice workflow to produce really beautiful high-end aesthetic restorations out of zirconia that look like layered ceramic, and they're milled monolithic, and the Ceramart makes them look spectacular, and it's a really, really smooth workflow. On the clinical side, we really focused on a couple, I'd say they seem like smaller pieces of technology, but sometimes small is really good. So Optrogate for us has been a really good product overall to help retract, keep the patient comfortable. We have a new version which has been really widely accepted because it's more patient compliant. It's easier to insert. Patients seem to enjoy it more. There's less agitation or irritation of the gums, and it just makes it easier to apply, which means for the doctor, you get retraction and it's more comfortable for the patient. Everybody's happy. So it's a really nice fit. And then on the block side, our portfolio has expanded a little bit on the block side as well. So we have a new Zirconia block that we've started to launch last year. High-end aesthetics, gradiated technology, really beautiful aesthetics, and it's very fast to be done chairside application. So it can be milled, sintered in 15 minutes in our furnace, and placed in less than an hour, 45 minutes, 40 minutes, somewhere in that range.
All right.
That's a lot.
There's a lot, but there's a lot that you both brought up that I kind of want to dive into just a little bit deeper on each of them. First of all, you said something, 20 years of e.max, and before the show we were talking out there, For me, it's hard to believe. Do you know what else came out 20 years ago this year? The iPhone.
I was guessing.
okay.
That's
The
what I was gonna
iPhone.
say.
Okay, so you think of two things that it feels like we've lived with forever, and we've got e.max that's been around for 20 years, and Dr. Horwitz just says it's only been 20 years. I mean, it seems like forever, but I am a huge e.max fan, so I do want to dive into that just a little bit because e.max is not just one product. So dissect it a little bit for me and tell me what e.max really means to Ivoclar and what we need to understand as clinicians. Obviously condensed because this could be a whole day topic, but as clinicians, what do we need to understand and what do you all put into e.max?
Yeah, so explaining the categories is real critical as you bring up. But e.max started as lithium disilicate. That's our foundation. I think 99% of clinicians would recognize it as lithium disilicate. 20 plus years of experience, 99.6% success rate, survival rate. So a very reliable, durable material. And then when we started getting to zirconia, we wanted to take that branding of confidence of e.max and transferring it from lithium disilicate to the zirconia. So we have Zircad Prime, e.max Zircad Prime, and e.max Zircad Prime Aesthetics. And then later this year in May, we'll be introducing a new zirconia, which has all applications from veneers, inlay onlays, all on X's, etc., full reconstruction areas, and highlighting strength. We've been able to optimize the strength with a 4Y, 5Y material that is durable as any other material, and then incorporate the highest aesthetics of Prime Aesthetics. So we're really excited about the technologies, and we gave the e.max name to both lines. So we have the lithium disilicate line and the zirconia line, coupled with the e.max brand accordingly.
Okay.
And that covers, to expand on that, so the family of e.max, as we call it, there were ingots that we pressed, there were blocks that we mill in specific partner mills now, and now we have it in disc format in zirconia. And the idea across all of the different ways you can produce it is that highly aesthetic, strong, durable, robust, and very clinically successful. So they all have to meet essentially that criteria. And then we label the ceram art under the e.max brand as well because it makes all of the ceramic materials, lithium disilicate, zirconia, really pop because you can do so much with it.
So what I want our clinicians that listen to take away is that e.max is a brand with a family of products under the e.max brand.
Yes.
Correct.
So you bring up something because I think that we've come a ways away from sending a restoration into the laboratory and saying e.max number 12. So how would you all suggest that a clinician learn about this? Would it be through partnering with a lab that really understands your line of products? If I want to work with Ivoclar products, could I call Ivoclar and say, hey, do you have a list of laboratories that you all work with that use the full line of your products that I could get the best restoration for that tooth and indication, and that the lab could help me teach? I mean, I work with a great lab that uses a ton of Ivoclar products, so I feel comfortable in that, but there's a lot of people that don't know what they're getting. So could they call you all and find a lab to partner with?
Yeah, we have a list of certified labs in that area,
Okay.
but Chad, you bring up a really good point. The partnership with the lab is really critical, and understanding materials for clinicians. I mean, you can cut a prep, just send it off and put down ZR, and you don't know what you get back. There's a responsibility by the clinician of the laboratory to really know what materials they're using. And on e.max right now, many know it as lithium disilicate, so it's routine. But in zirconia, most clinicians, by surveys from AGD and others, just write ZR on it. And they don't even know what they get back. And it could be a 3Y material, a combination material, a 4Y, 5Y, whatever it is. And all those materials have different properties on preparation, placement criteria, etc. So you really got to work with your laboratory and know what you're using. And we educate the laboratories to know what they do, and then we provide courses and tools for them to communicate that to their clinicians to educate them. So a message to your viewers is think what you're doing and think what you're placing, and work with your laboratory to know what solutions you have.
I love what you just said, because when I speak on this, it's like if you don't have a contact at the laboratory that you can call that will actually answer and speak to you and tell you what, help you through what you're doing, then you're with the wrong lab.
Right.
So I do think it brings up a very valid point. Now, I don't think that a lot of people realize that e.max is also a brand of zirconia as well. And I
Agreed.
know you guys both just mentioned it, but zirconia, zirconia, zirconia. Everybody's using zirconia. Everybody wants zirconia. What does zirconia mean to Ivoclar?
Well, it's a new trend, really, from a foundation material. Many restorations are going to zirconia because of the versatility, the strength, the flexibility of preparations, etc., for that matter. As we started the topic today, we're an innovative company and we strive for the highest product. So there's the material components that you put in, how you process them. It's like a chef, you can take tomatoes or whatever, and a master Michelin star chef can make it this way, or he can just pop it in a microwave and serve it. So the processing of zirconia is really critical, and then the technology goes behind it to enhance it. So as I mentioned, this new zirconia coming out, as well as our existing ones, but dimensional stability, real critical. Strength, durability, fatigue resistance, and then optimization of the aesthetics. We have this gradiated translucency that it's virtually invisible relative from the cervical area to the incisal, where you see a complete blending of translucencies throughout the material. So we provide high technology zirconia, and it's a premium product, but some may go with price and just get a bunch of powder thrown in there and something milled out and cemented in. We focus on the highest technology, strength, durability, and aesthetics in these types of restorations.
All right. I love it, but we're going to go a little bit deeper.
Okay.
And I'm going to throw a question out because I see this on social media all the time. And it cracks me up. It 2 to 3 times a day, somebody will post, what's the best cement for zirconia? All right. So if you ask me, I think that's the worst way to ever ask a question. I never answer it. But I think that there's so much to that question that doesn't really lend to a particular answer, but I'm going to ask it a different way. Are you all of the thought and belief that you can bond zirconia?
So we've done an extensive amount. So coming back to your other question, it's no different than knowing what you are putting in. It's knowing how you treat restorations. It's really critical. So I'm going to answer a question, but I just want to do a preface to that is preparation designs are variable depending on how you cement it. How you treat the restoration depends on what your clinical conditions are and what you're trying to achieve. And if you follow the proper protocols, you can get very high success. So on retentive preps, you can use traditional resin ionomer eluting cements. We have one called Zircad Sem, which is very, very popular for that
And
matter.
that's a resin modified glass ionomer?
Yes.
Okay.
For standard preparations. As far as when you move into adhesive properties, you can bond to zirconia and get very, very good bonds, but you have to make sure that you clean the surface very lightly, air abrade, not too much air abrasion, but just low pressure and to clean off the surface. You want to clean it off with a protein dissolver as far as like Ivoclar, and then put MDP is the critical factor on the zirconia. So we have a product universally for Monobond Plus, and then our self-adhesive cement, Speed Sem, actually has it built into the system. So there's MDP built in the cement. So as long as you clean the surface, clean it off properly with sandblasting, Ivoclar to remove the proteins, and then properly prime it with MDP, you can either use our VariLink aesthetic, which is a high resin material for bonding, or use our Speed Sem, which is a self-adhesive type of cement. And then for classical preparations, you would use a Zircad Sem or resin ionomer for traditional preps that are retentive.
So maybe to give some context to that, really great explanation. If you go back in time, because I've been with the company 26 years now as well, not as long as George.
Not 40.
Yeah.
But going back in time, when adhesive bonding first became, we're going to start bonding restorations, really good bond strengths were 20 plus, right? And then it's over time, you've got bonding to ceramic it's still probably a gold standard. You can get 35 megapascals, 40 plus. You can get good numbers with zirconia that are 18, 20, 22 megapascals. So if you look back at how we were bonding 15 or 20 years ago, that's, as a comparable, that's kind of the bond strengths you can get with zirconia today. And that was acceptable, not only acceptable, that became standard of care. So
Yeah.
I think it's a good reference point because if you compare it to just straight glass, it's going to be, I don't get as good a bond to zirconia as I do to glass, but you still get very clinically successful numbers.
And I want to bring up a point too, because you mentioned Monobond Plus, which I think is just a stellar product. And if you look at Monobond Plus, you can do zirconia, you can do e.max or lithium disilicate, and you can do metal.
Yep.
It handles all three products, so it creates uniformity and consistency within the practice to be able to use it. And one of the things that I'm gathering, and just kind of briefly touch upon this, there's no right answer to what's the best cement to bond zirconia with. We know that we can bond zirconia. I truly believe that you will bond to zirconia with resin-modified glass ionomer because it's in the studies. It's not as strong of a bond,
Right.
but it's a bond.
It's got a bond.
Now, the other thing is that we need to hammer this, that to properly answer that question, we need to look at our prep. And you said that. And so for a non-retentive preparation, we're going to need to use the maximum strength, so an adhesive cement with an adhesive resin to in addition to the cement. And for anything else that's fully retentive, we can use self-adhesive resin, or we can use resin-modified glass ionomer. So the question's not in the material of what the crown's made of, it's in what your prep design looks like.
But on the topic, it's so no different than knowing the material. You got to know your process, and
Absolutely.
It's not one for all, but you understand the clinical situation. You got a short TP prep on a second molar. It's got to be bonded in. It's not going to be retentive for that matter. So know your prep, know the process, and how to treat it properly.
And then I do think that just because of the similarity of names, I'd like to touch upon another product real quick that we didn't talk about pregame, but I'm going to ask, is it okay if we talk about Monobond Etch and Prime?
Sure.
A little bit. So to treat the intaglio surface of a lithium disilicate restoration is much different than that of a zirconia. So if you could touch upon that, and then what Monobond Etch and Prime brings to the table.
Yeah, so Don alluded to it. We try to not only develop products but workflows and simplification. So in the previous times, we had silane, we had metal primers, and so you'd have 3 bottles in your office.
Etching, phosphoric acid, etching surface.
Yeah. So through simplification, we're trying to streamline the workflow to make it simpler for the clinicians to handle the types of material. So we have a product called Monobond Etch and Prime, and it's got the primer in it also as far as the silane component for that matter. So in lithium disilicate, you can use etch and prime and rival the strengths of traditional hydrofluoric etching and silanization with the Monobond Plus for that matter.
And I think some to comment too on the why behind some of the technology advancements. Going back in time, 20 years, we launched e.max. 5 years into that, we launched the e.max block, and people started using it chairside. And that's when you started to see offices come into our facility for open houses with staff, and they were talking about nuisances they had in their practice. I've got staff etching restorations, and I don't feel comfortable. I mean, that was a real thing. And you start to look at it and go, that's a really good point. And it became a development project for us of how do we combine something and make it safer, but also more efficient in the practice.
Yeah, that's a good point, Don, because the thing is, the most purest bond is a freshly etched surface.
Absolutely.
So if the lab etches it, they send it to the clinician, he tries it in, it's contaminated. And then you have to make sure you're thorough with the Ivoclar, et cetera, to clean it off for that matter. So it can be done, but there's nothing more pure than a fresh etch. So we try to simplify it for that process, and then also chairside CAD/CAM technology is simplification, speed and efficiency. And so the more you can combine, you can improve and enhance the workflow. So that's why the product is so relevant.
I couldn't agree more. I mean, I always speak to the fact of how truly dangerous hydrofluoric acid is. We need it. I use it. I use yours.
Sure.
Okay? We need it. However, in my practice, I am the only person that touches the hydrofluoric acid. If anybody's going to get burned or handle it wrong, it's going to be me. Okay? But I love having, for chairside restorations, I love having the opportunity or the availability of Monobond Etch and Prime. I think it's just a wonderful product, and the studies will show it's highly effective.
Very highly
so,
effective, yeah.
So I'm glad that we were able to segue into that, and I was hoping it was okay. We've talked a lot about indirect materials and indirect solutions, but before we go to direct, let's talk chairside. And you briefly in the intro mentioned mills, but if I'm a dentist, I am a big believer that every office needs a mill. I don't think you're going to use it on every single patient.
Sure.
There's still a lot of value in the laboratory, but I think every office needs a mill. So what solutions do you all have for a doctor to bring a mill into their practice?
Yeah.
And you take that.
I'll kind of phrase that a little bit, or maybe provide some context to it too. Some of it starts with what do you want to do in your practice.
Sure.
So I'm in a practice and I'm looking at how do I maybe become more efficient and focus on single units that present a case I can do in one visit.
Absolutely.
Super gingival, I can do
Yeah.
the crown, it's under control. If not, maybe I park and go to my lab. Or I'm a practice that's looking at, I'm willing to take on more production and maybe larger cases, multi-unit bridges, maybe full arch cases. Maybe I'm placing implants and I want to start doing the entire restorative process. So a lot of that helps dictate what direction I go on mills. So if I'm looking at single units, I've got CEREC technology or Plymeka technology, VHF and others that are really good, efficient, single unit block milled restoration products. They're fast, they're efficient, they're validated by us, you're going to get a good quality product out of it.
Sure.
And then if you're looking at doing larger type cases, you're talking about having disc milling technology in your practice as well. And we're doing similar, like we do with blocks, we're validating more mill partnerships or more partners to mill all of our products efficiently, whether
Okay.
you do a restorative, fixed restorative, or whether you do a denture. And it's really just to fit what's happening in the practices can expand their capabilities to produce. We want to make sure we can at least guide you with a solution. So we have materials that can service all that. We have basically partnerships with all the machine companies to generate the best solution for you. Our mills are all larger, they're disc sized, and they can be retrofitted or have, with an insert to be able to do blocks. But they're more of that than they are a single unit mill like a CEREC machine or a
Chairside.
VHF. Yeah.
So if I'm interested in Ivoclar materials and incorporating them into my practice, I'm just going to say I bet your feet on the street could help that doctor
guide that. They're going to
guide
ask the
that
same
decision.
questions. Basically,
Yeah.
I'm asking, what do you want to do? Where are you going with your practice? What are you looking to produce? What types of materials? Because that'll dictate furnaces. As you know, you got to
Sure.
know what materials you're going to utilize and focus on, and then you can help construct. This is what you need. This is how we can help you get started.
And if I can add to that, Chad, as far as you have in your practice, but no different than zirconia, cementation, you have to dedicate yourself to implement. So
Yep.
you gotta, you don't just buy the machine for the sake of buying the machine. It doesn't operate itself. You have to understand the workflow, how you integrate in your office, and dedicate yourself to make it efficient. Because sometimes somebody buys a machine and sitting gathering cobwebs in the corner or whatever. But staff training, your self-training, and integration, and the philosophy of how to utilize it. But there's all kinds of different vehicles and price points to enter a chairside technology, and it's a game changer relative to patient acceptance, providing same-day dentistry. It's really revolutionary, as you mentioned, in your practice.
You and I should teach some courses together.
I'd be happy to.
I mean, you and I have the exact same philosophy because I'm a big believer in, I'm going to break it down. You said you need to figure out your why.
Yep.
Why are you doing this? Why are you doing dentistry in the first place, and why do you feel the need for a mill or integrating technology? But also the second thing that you said, I call it the SMU principle. When you integrate technology, it needs to be systematic and methodical.
Mm-hmm.
But it most importantly needs to be understood, not just by you, but by your team.
The staff has
And if they don't
buy in.
embrace it, you're done.
Yeah, you're cooked.
You're done. So that was so fun talking about indirect restoratives.
Maybe
Let's
comment too. If we
no
can.
comments.
No,
No, go ahead. Go
Not
ahead.
even a
Absolutely.
comment, more of a trend, and it's probably maybe a question or for your listeners.
Yeah.
We see trends now, more of the practices that are doing larger cases, placing their own implants, doing all on X type applications. Do you see the same? I guess from your perspective, you probably interview a lot of people, and what are dentists looking for maybe for guidance in that regard? I know we're kind of flipping
all on
roles here
X
a little
stuff?
bit.
Yeah.
Yeah. Like
I think it's definitely a hot topic, and people are looking for guidance on that. They're looking for, in my opinion, a consistent scanning solution.
okay.
They're looking for a consistent milling or design solution. Let's go, because we got to scan it,
Scan design.
then we got to design it, and then we got to print it. And so they're looking for a consistency in workflow, and I think we're at the point where we are with a lot of technological information and integration. that there's a lot of differing opinions, and I think we're all trying to narrow down what's the best. There's a bunch of solutions out there, but we're trying to narrow down what's the best. But I do think that it's a very, very hot topic in dentistry. Personally, my standpoint is at this point in time, I want to farm as much of that out to the laboratory as I can. And when I take on a case like that, I want it to be a partnership with the laboratory where I diagnose, I start the case, but I want the lab to hold my hand throughout the process. So for me personally, it's finding a lab that has experience and that is willing to basically, babysit me through the process.
Great, and I think that's part to your point earlier about the lab, and our point about lab-dentist partnership is really important because they can be a great resource and a great asset to help guide you making decisions so you get a great result. So,
yeah.
I think if it escalates, we talked about Chairside, for a single unit, but when it gets all in X's, et cetera, that partnership's impeccable. It's
absolutely
mandatory.
I think maybe, I don't want to disparage any restorative labs, but I think that this partnership, what we're talking about with All on X, it's even more important to have that personal relationship and that communication, because I fear that there's a lot of clinicians out there that are doing it just because they've heard about it, they've heard it's great, and they don't really understand the occlusion, they don't understand the longevity, and if we're not firing on all cylinders, we're not going to get longevity. And so that lab, somebody asks me, I said, you need to find a lab that's done a lot of these, and then they're sometimes better than us as clinicians because they understand the fundamentals.
Very much so.
It's great.
So let's talk direct restorative. I know you all are, in my opinion, everybody sees e.max and they think of Ivoclar, Let's talk a little bit about direct restoratives because my good buddy David Rice is really high on the hog on your direct restoratives. So let's briefly touch upon that.
Don, I'm going to turn that over to you.
Sure. Yeah, we have a great portfolio in the direct restorative line. We have Tetra Prime. We have 3-second power cure system. They offer different, let's say, efficiencies in terms of how they work. Speed, efficiency, really aesthetics of how the materials function. The Adhesive Universal pen system is amazing from an application standpoint to get a really good bond, but it doesn't waste product or materials. Our Optrogate for retraction is really excellent, and then our curing technology and our polishing systems are all very efficient. So I think David looks at it from the perspective of when I step into a clinical situation, I can use an entire workflow of really aesthetic, highly filled material for light curing system with our composite system of one of the Tetra line products, because there are multiple products they can use. A very efficient adhesive system, and then all the other components like the gate, the curing light, and the polishers just make the whole process go very fast, but you get a great result. And at the end, the restoration disappears. It's very clinically successful, but it's very, very efficient. And I think for you or for any doctor, it's, direct restoratives are, you get reimbursed where you get reimbursed, and you're trying to be efficient in the chair. So our systems, we try to make very efficient to get a great result, but also be able to move quickly through them and be able to do more in the chair than ever before.
If I could add to that, but we have products, but everything's focused on workflow, simplification. So there's a solution. So from start to finish, from diagnostics to preparation to insertion, the adhesive system, the Adhesive Universal is amazing with the pen delivery for simplification. And then the retraction devices and polishability, and then the power cure system is speed and efficiency. If they're a 3-second cure, depth of 4 millimeters, it's a workhorse, especially posterior restorations, et cetera, for that matter. So we try to look at a solution versus, here's a gadget and here's a widget for that matter. So that's how we approach things.
I love it. I'm going to say that you talked about a lot of things, but out of direct restoratives, I'm going to hammer in on that adhesive pen. That is such a slick innovation. When I speak to people, everybody is concerned about waste. Waste. No waste. It's really cool. If you have not looked into the Adhesive Universal pen, please look into it. So we've gone direct. We've gone indirect. We've gone direct. We've gone chairside. We've gone all over the place with this. But one thing that I don't know that a lot of people know is that you all actually have a preventative portfolio too. So how do we stop the damage from happening and prevent it from happening again?
Yeah, so there's we have a product line called Vivident, which is our prevention and care division, and its number one is to prevent, to provide prophylaxis, et cetera, for that matter, and then how to maintain restorations. So we have a series of product from fluoride varnishes. Specifically, we have a product called Cervatec, which is amazing. It's a chlorhexidine-based product, and the benefit of it is the tissue rebound is just tremendous. And you can place it at a hygiene appointment and maintain 3 months of gingival health. It's a great tool relative, especially for fixed prosthodontics, because relatively to applying it before preparation, the tissue rebounds, etc., and especially if you're doing chairside dentistry, everybody hates the most is you pull out an old amalgam, it's got an overhang, there's bleeding everywhere. So by treating it with the chlorhexidine varnish, you heal the tissue before the preparation, you get nice clean margins, etc., and it speeds up and enhances your whole productivity. So there's a whole series of products there in prevention. And then a small little product that's it's kind of a sleeper is our polishing prophy paste.
Yeah.
We have a very extra fine, and it's the only polishing paste that actually provides a luster to the restorations, because what do? We put in beautiful e.max restorations, then we grab our coarse and we
Yeah.
rough it all up in
Scratch it up.
in a 15-minute polish or whatever. And this is the finest grit that you can possibly achieve, and it provides an enhancement of maintaining those high aesthetic restorations. So it's a beautiful product line.
Yeah, and I think we're going to continue to grow the line and expand what we're doing. And I'll comment on the Cervatec for a second. It was one of the first times we saw it really used well in application. Chairside is a great application. Also, Chairside, if you place a temporary and you're able to treat the tissue, patient comes back in 2 weeks, generally speaking, temporary comes off, no bleeding on seat day, which is, typically that's not always the case. So you remove a temporary, you might have bleeding. That affects your cementation protocol. So that's one of the big benefits of treating it during the temp process, means you're going to have a much easier seat day. And then on the overall portfolio, we're looking at to expand what else can we do to do preventative upstream treatment, because I know we restore and we do a great job restoring teeth, but we want to get much better at how do we help restoring or preventing that from happening so we don't get to the restorative step. And it's a challenge, but I think the direction of dentistry, I think, is starting to move more toward how do we help patients prevent disease
You nailed it.
challenges, right? That's the direction. We're trying to be very good at what we do and create a portfolio that'll help provide that solution.
And
as
on that
well.
topic, just we're expanding and looking at the whole picture, from saliva diagnostics, et cetera, the oral systemic health. That'll be a broader picture. We're not there yet, but so we have products that enhance. And just coming back to that Cervatec, it's a game changer. Chairside, pre-treatment, it speeds up your process, heals up the tissue, and then in just general crown and bridge, as you mentioned, temporization, you pull off the temporary, nice clean tissues, you cement. It makes you enhance your productivity and benefit to the patient, of course, versus struggling with bleeding conditions accordingly.
I've been doing this for 25 years now, and I would go to meetings and people would talk about building a preventive portion of their practice, and it's ignorant for me to say this, but I'll say it. I don't think I ever really fully grasped that or understood it. I think we're at a real turning point in dentistry. You were asking about trends earlier about something else, but I think a hot trend in dentistry is AI.
Mm-hmm.
However, if we use AI appropriately, for the past 4 years, what I have grown through AI is my preventive aspect of my practice. So I think that since you all are so, I would say you guys have a real good grasp on prevention, and I think it's perfect timing. With AI becoming a big
Mm-hmm.
part of our practices, if we use it appropriately, I think it's a perfect time for people to build that preventive aspect of their practice. I can't thank you guys enough for being here today. I think we hit. There's a lot more we could probably hit upon, but I do want to close with one statement, and that's once again innovation. But there's 3 words that I want to throw out there, and it's efficiency, consistency, and predictability.
Mm-hmm.
And I think Ivoclar provides a solution for offices to attain that. The other thing that I want to close with is that we talked a lot about systems. I'm big on systems. And just remember that systems were manufactured in the same place. They were designed to work together. And we should stay within the product lines. And the last thing that I'll say is that as a consumer, I know your price point. It's very competitive. And I don't think that you're going to be overpaying for a product that is superior to others. So thank you
I
guys.
appreciate
Thank you,
that.
Chad.
Thank you.
Great
Thanks
to
for
be here.
having us.
Thank
It's
you very
great.
much.
You
Great
bet.
to be here. Thank you.
Thank you.
Thank you.